Hello everybody, welcome to another presentation of a kind of life-changing work that we at London Dental Specialists carry out on a routine basis. If you like our videos, please subscribe to our YouTube channel and also follow us on social media at London Dental Specialists on Instagram and Facebook. So let's get into today's presentation. It is about this 61-year-old lady that was referred to see me by one of the excellent network of hygienists in and around London due to the hygienist's concern about the generalized and severe nature of this lovely patient's gum disease. Now, because there is a lot going on in this patient's mouth, what I've decided to do is split it in half. So present what we did on the right side of the patient's mouth in this video, and in tomorrow's video I'm going to present what we did on the left side of this patient's mouth. So this is a picture of the right side, and the main issues are around these big chewing, they're called the molar teeth, on the right side, on the top right and the bottom right. And let's look at the X-rays. These are X-rays. This is an X-ray of the back 3 or 4 teeth on the right side, on the upper right, and this is the X-rays of the last 3 teeth on the lower right as well. And for those of you who've been watching my videos, you'll recall that I always mark the normal bone levels with this green line, and this yellow line indicates how much bone has been lost in the top right side of the mouth. And again, green on the lower right side of the mouth, lower right back teeth, is represented by the green line. That's a normal bone, and this is the level of the bone loss that has actually occurred in this lovely patient. So if we then look at this patient at the start, and this is exactly what happened at the end. So what did we actually do? We carried out some surgical treatment of her gum disease, and the aim of any kind of gum disease treatment is to ensure that at the end all pockets are 4 millimeters or less, because the scientific evidence is very clear that if it's 4 millimeters or less, the chances of you being able to keep those teeth for the rest of your life are actually very good. But the moment it's 5 millimeters or more, the risk of you losing those teeth at some point increases exponentially. So on the right side, this is what these teeth look like at the start, and this is what these teeth look like at the end. And so what are we looking at? The main thing here is, if you see one of the roots is missing, basically you can see that there's a hole in here that does not exist at the start. And that's because I did some gum surgery and removed one of the roots here to allow the pocket become 4 millimeters or less. And again, on the upper right side, I removed one of the roots on that last tooth for the same reason. On the lower right side, I was able to expose what is called a furcation, and that's once you can expose that area and show a patient how to clean into it, the prognosis of the tooth increases dramatically. But I wasn't able to do that predictably on this last tooth on the lower right. So what I also did was remove one of those roots. And you might be thinking to yourself, if he removes the root, is the tooth going to fall out? No, it is. There was no difference in the looseness of the tooth before and after treatment. In fact, they were not loose. Because I had removed the roots, what I had to do was get our wonderful root canal specialist, Niha, to do some beautiful root canal treatments. And I did so. And this is an X-ray of her root canal treatments. These white lines are what she did for us on the upper right, second to the last and last tooth in the upper right. And again, on the lower right here, as I said to you, I removed one of the roots, and that's why there's this area here with essentially a missing root. But I didn't need to do it for the penultimate tooth on the lower right, and so our patient is able to insert a TP brush, a normal interdental brush, into that gap, leading to excellent prognosis in the long term. How long did all this take? 2 weeks. 2 weeks. It's really, really fast, because as long as you're quite happy to have all the surgery done in one sitting, perhaps under intravenous sedation. That's how I like to do it. That's how I like to do surgery, because in the end, it just gives you one healing period, and that's it. The cost to this particular patient, the financial cost to this particular patient for the treatment on the right side was £5,000. And then if you compare that with the cost of replacing these teeth with dental implants, that would have been about £12,000, because that one of the reasons for the expense in the dental implant in this case is because the bone that was lost due to the gum disease has to be put back before any dental implants are done. And I've just put a note here, or a note of caution about diet and maintenance. The prognosis of these teeth is excellent as long as the patient comes for regular hygienist maintenance and ensures that the sugar in the diet is severely restricted to mealtimes and mealtimes alone. These treatments work very, very well, but these teeth, because of the gum recession, become really sensitive to sugar. But as you all know, sugar will cause other problems anyway. So why not, please, pick up the phone or get your hygienist to pick up the phone to us and let us work with you in treating your gum disease. Because if you come to us when the teeth are still firm, we can predictably, both Niha and myself can predictably save your teeth for a very, very long time. Join us tomorrow to see what I did on the other side of the mouth. Many thanks.